Hi, this is Dr. Carl with Infinity Health. I'm going to bring another video today. A lot of people are requesting a video on sun protection and sun exposure. So with the Jazz Fest coming up and then the rest of summer coming up, I want to cover this topic. Ultraviolet light from the sun feels good, it feels warm, it gives you a tanned complexion, which some people like, although that's not particularly important. But what it does cause, we know, is sunburn. People's skin can get reddened, it can get blistered, and it can become very sore and painful. So here's a couple examples of sunburn. One example here is simply some reddening of the skin, which is nothing serious. And the next photograph here is somebody with blistering sunburn. We see this quite commonly. Now, in any of these cases, there's nothing really you can do about it. You can use cold compresses or ice water application, but nothing is going to really treat this to change how long it takes for this to heal. So we want to avoid sunburn and protect yourself for that. But more importantly, there's a couple other issues. One issue is a skin condition called rosacea. It used to be called acne rosacea. It's where the ultraviolet light causes certain vascular changes, blood vessel changes of the skin, nose prominently, but other parts of the cheek. You notice a diffuse reddening of the cheek. You notice little blood vessels showing up. And you'll find sometimes even lesions that look like acne. This condition is not reversible, so it's treatable with a medication, but you want to try to prevent this. The antibiotic cream we use does help, but here's a picture of rosacea of a relatively mild form. You notice the face is slightly reddened, you notice some blood vessels showing up. That is something that maybe we can live with. But if rosacea, especially in males, if it's left untreated, it can cause a chronic thickening of the skin, especially the nose. So we see people like in this photograph getting something called rhinophyma, which is a W.C. Fields nose. And the only way to correct this is not with creams, but it's surgically removing this tissue, which rarely people do. The last thing I want to talk about is sun-induced skin cancers. Now typically here, sun-induced skin cancers, ultraviolet light causes damage to the skin. The body repairs it. But sometimes the repair doesn't take place, and this damaged skin cells start to form an abnormal cell growth. And here's an example of an actinic keratosis. This is very common. We freeze these all the time. These are precancerous. They have about a 5% chance of turning into cancer. Now, what type of cancers do they turn into? Typically, this is not melanoma we're talking about. Typically, it's these two cancers. On this photograph, you see squamous cell carcinoma, very common skin cancer. In the next photograph here, you see a basal cell carcinoma. Now, the good news is these cancers typically don't spread to other parts of the body. However, they do need to be removed in some fashion, often with some surgical excision. So how do we prevent some of these things? Well, for the face and head area, the main thing is a hat. You want a hat, not just a cap. A cap only covers your eyes and shades you and maybe covers your forehead. However, I do remove a lot of cancers from the ears, and the ears are not protected by a baseball cap. So you want to take it a step further. Wear a hat as often as you can. And of course, the second thing is sunscreen. You want to get a high SPF value, but more importantly, you want a sunscreen that you feel comfortable putting on, that's not too greasy, and one that you put on repeatedly and carry with you so you can put it on every couple hours after the other stuff sweats off. So keep that in mind. Make sure you protect yourself against sun damage to prevent sunburn, but more importantly to prevent rosacea and to prevent cancer. So thank everybody for listening, and if you like this video, like it and note below, and also make sure to subscribe, and we'll bring you some videos in the very near future. All right, happy summer and stay safe.